Hello, I'm Doug McLean.
I'm Tony Zachary.
And I'm Vera White. Like you, we're patients with high-grade non-muscle invasive bladder cancer who have been treated with BCG.
We're showing you this video because your doctor has recommended this research study for you. This video will help you learn more about our study and the positive impact it could have on patients just like you. I was diagnosed about 3 years ago with high-grade non-invasive bladder cancer and have been treated with BCG induction and maintenance.
I was also diagnosed with high-grade non-invasive bladder cancer and was treated with BCG. I'm now undergoing maintenance treatments in my bladder to keep the cancer from coming back.
And like you, I have non-invasive bladder cancer that returned after being treated with BCG. After this video, you will have an opportunity to speak further with your doctor and the research team to answer any questions you may have.
Hi, I'm Dr. Seema Porton, and I'm a urologist at UCSF who treats patients with bladder cancer. Bladder cancer is the 6th most common cancer in the United States. Unfortunately, compared to other common cancers, bladder cancer has been understudied with less research completed. As a result, there are a lot of unanswered questions that make it difficult for patients and those who care for them to make decisions about their treatment options. This study has the potential to answer some of these questions, ultimately helping to identify the right treatment for the right patient at the right time. The goal of our study is to compare the outcomes of additional therapy with medicine to bladder removal in those with non-invasive bladder cancer that has recurred or not responded to treatment. We will ask patients questions about their experiences following treatment for up to 4 years. In some cases, we will also ask the same questions to the person who partners with patients in their care decisions. Along with these questions, we will ask about how they made their decision between bladder removal or additional therapy with medicine. The goal of this study is to help future patients and those who care for them make better informed decisions based on their preferences and the outcomes of patients just like them. One treatment option for patients like you with recurrent non-muscle invasive bladder cancer is to try additional therapy with medicine. For most people, additional therapy with medicine is having drugs like BCG inserted directly into the bladder. This allows you to keep your bladder, but carries the risk that cancer could come back or spread outside of the bladder. The other treatment option is surgery to remove the bladder. This surgery is more likely to cure you, but could impact your daily life and activities.
Choosing between additional therapy with medicine versus removing the bladder is an incredibly difficult and personal decision. This is why patients like you are needed to enroll in this study. Your involvement in this study will allow us to learn from your experience to help future patients in the same challenging situation. With this study, we will learn more about who benefits most from each treatment. Additionally, you can assist their doctors, caregivers, and entire healthcare team in determining how best to support patients like yourself.
This study is unique because over 1,000 bladder cancer patients and doctors collaborated together to identify the questions that were most important to patients. We have a team of patients and caregivers who have agreed to continue to provide input into the study design as well as the results. It is a study created by patients and for patients to help guide future people just like you. We are inviting you to participate in this study. The treatment that you choose is completely up to you and your doctor and does not impact your ability to participate in our study. If you choose to participate, we would collect data from you about your experiences during and after your treatment. Your participation is completely voluntary and you will be compensated.
Like you, I had to make a decision about which treatment option to choose after BCG stopped working for me. This was a difficult decision, and not a lot of research had been done to help patients like us make their decision.
This study will look at outcomes that patients identified as being important to them and their families. Quality of life after treatment and the impact on an individual's finances are some examples of information that will be gathered. If you choose to be a part of this study, this information will be collected directly from you.
If you decide to participate in this study, you will be asked to complete several surveys per year for up to 4 years. Patients like me tested these surveys and found that they take about 20 minutes to complete. time that you will be reimbursed for.
In order to understand how your experience relates to outcomes from your treatment, we will also use your medical record to obtain information about your medical history, the treatment you selected, and the results of your treatment. Please know that your name and your personal health information will be kept private. The research team will discuss these details with you after you finish viewing this video.
It is important to us that we represent all types of patients, including people of color and women. If you take part in this study, you will be helping people like you make decisions about their healthcare journeys, decisions that will be informed by the critical information you provide as part of this study.
Ultimately, what does it mean to be part of this study?
Being part of this study means lending your experience in order to help future patients, their doctors, healthcare teams, and caregivers make important decisions about their bladder cancer treatment.
Being part of this study means that you would help patients like you make decisions regarding treatment should their bladder cancer return.
Being part of this study means helping patients make the tough choice between bladder removal and additional therapy with medicine.
We hope this video has helped you learn about our research study and the important impact it could have on patients like you. Our research coordinator will give you more information and ask if you're willing to take part in the study. Your doctor and healthcare team can also answer any questions you might have about which treatment option is right for you. No matter what path you choose to follow, your healthcare team will be here to support you throughout your treatment. We wish you the best. Thank you for considering to participate in this important study.